helps the voiceless creature. Hello everyone, welcome to my channel, The Vet Tutorial. Today we are going to study the anatomy of digestive system part 2. In this we are going to study about different types of teeth and salivary glands of animals. And lastly I will give a bonus information. First, introduction of teeth. As we know that each species has its own characteristic dentition describing form and number of teeth. The teeth develop differently in each region of the mouth according to their use and are grouped into incisors, canine, premolars and molars. This characteristic feature is termed as heterodonty. It is a Greek word in which heteros means different and odont means tooth. The dentition of domestic mammal is diaphodont, in which first erupted teeth are replaced by a single set of teeth in older animals. First set of teeth is deciduous teeth, which means it is present at birth or erupt shortly afterwards. These teeth are replaced by second set of teeth, that is permanent teeth, which is adapted to the larger jaw and provide more vigorous mastication in adult animals. The number and classification of permanent teeth is fixed to a species. And remember that in other vertebrates and most toothed fishes and many reptiles like crocodile and ginkgos have a polyphyodont dentition, which means multiple set of teeth erupted throughout the life of animals. Then let's study briefly about the function of teeth. It helps in mechanical breakdown of food, in which food is broken into smaller pieces by tearing, cutting, crushing action of the teeth that occurs during the process called mastication, or we can say chewing. Then let's study about structure of teeth. All animals share a common basic architecture in which each tooth is divided into three parts: crown, neck and root. Then first study about crown. It is the exposed part of the tooth which protrude above the gum, and it is covered by a very hard translucent material, that is enamel. And remember that it is the hardest substance in the body. Then let's study about neck. It is the slight constriction located at the gum line where the enamel ends, and it is present between crown and root. Then let's study about root. It is the portion below the gum which is embedded in the bony alveolus, and it is covered by a thin yellowish material, that is cement. And then let's study the position where the teeth is present. It is embedded in the upper maxilla bone and lower mandible bone along the margins. They are found in the socket or cavity called alveolar socket. And remember that the bulk of the tooth is formed by dentine. It is present under the enamel and it is the hard as bone but not nearly as hard as enamel. The dentine is composed of well-organized dentinal tubules. And remember that within the dentine there is a central canal known as pulp cavity that contains the blood supplies, nerves, connective tissue which supply the tooth. The cavity is expanded at the closed end to form a pulp chamber. The canal is narrow at the root, which opens into a apical foramen at the tip of the root, which is also known as apex. And remember that the pulp cavity is lined by a layer of odontoblast cell. In between the bony alveolus and cement, there is a layer of collagen tissue which helps in suspension of tooth into the socket known as periodontal membrane. In short, we can say that there are three mineralized substances of the tooth. First is enamel, second is dentine and third is cement. Then let's study about the surfaces of the tooth. When performing a dental cleaning or any clinical circumstances, it is important to know what the different surfaces of the tooth are called in order to document properly where the lesions has occurred on the tooth. Then first is surface towards the cheek, which is called as buccal, and then towards the lip, which is called as labial, and facing the tongue, which is called as lingual, and the surface facing the soft palate is called palatal. And then the edge of the tooth facing the midline or center of the dental arch is called mesial surface, and the edge of the tooth facing away from the center of dental arch is called distal surface. And remember that both mesial and distal surface refers to the part of the tooth that is touching or nearly touching an adjacent tooth. then grinding surface or masticatory surface, or we can say occlusal surface. These are the surfaces on the upper or the lower teeth that comes together when the mouth is closed. Then let's study about the brachiodont or low crown teeth. The crown remains above the gingiva is known as brachiodont teeth, and it is found in the man and carnivores. And then let's study about the hypsodont teeth, or we can say high crown teeth. A considerable part of the body along with the covering of enamel remains below the gum is known as hypsodont teeth. It is found in horse and ruminants. And then let's study briefly about the heterodont teeth. Mostly domestic animals have heterodont dentition. There are 4 different types of teeth, that is incisors, canine, premolars and molars, and each of them have different function. First is incisor. They are found in the premaxilla or incisive bone. They are small and often used to cut the food. In some species such as ruminants, the upper front incisors are missing. Instead, they have thickened region called a dental pad, upon which the lower incisor can grind or crush the food. And remember that in elephants, the tusk is the modification of first incisor. Then let's study about the canine teeth. They are located in the maxilla bone and the mandible. And remember that these teeth are sharp and pointed, and they are used to tear flesh and hold the prey. And then let's study about the premolars and the molars. They are also called as chick teeth, and they are found in the maxilla bone and the mandible. And the function of premolars is shearing, cutting, slicing meat from the bone and grinding the food into smaller pieces. And remember that the molar, which are only found in the adult dentition, also assist in grinding and shearing. Here we ends the heterodont dentition. And then let's study about diastema. As the face of most of the animal are elongated, some considerable space between the teeth in the form of arcades are available. This interdental space is called as diastema. This space is well noticed between canine tooth and the first premolar. Remember that the vestibular cavity and the oral cavity of the mouth communicates through the diastema. And then let's study about the eruption of teeth and dental formula of different animals. And then let's first study about the eruption of permanent tooth in ox. Although it is variable from breeds to breeds, there is general rule for the eruption of permanent tooth in cow. Incisor 1 erupts at the age of 18 to 24 months. Then incisor 2 erupts at the age of 24 to 30 months, and then incisor 3 erupts at the age of 30 to 36 months, and lastly incisor 4, also called as canine, erupts at the age of 40 to 48 months. All the permanent premolars erupt within the 36 months and molar appears earlier. First molar generally erupts at the age of 6 months and the other molar appears within 30 months. And then the dental formula of the ox. First, deciduous teeth. We are going to see the half of the jaw. First, deciduous incisor teeth. As we know that upper jaw do not have incisor teeth, therefore we denote as 0. And the lower half of the jaw have 3 incisor teeth. And then the deciduous canine. The upper half of the jaw do not contains canine, hence we denote as 0, and the lower half of the jaw contain 1 canine. And then let's see about deciduous premolar. The upper half of the jaw contains 3 premolars and the lower half of the jaw also contains 3 premolars. And then let's study about the dentition of permanent teeth. Here also we are going to see the half of the jaw. First, incisors. The upper half of the jaw contains 0 incisor and the lower half of the jaw contains 3 incisor. And then the canine. The upper half of the jaw contains 0 canine and the lower half of the jaw contains 1 canine. And then premolars. The upper half of the jaw contains 3 premolars and the lower half of the jaw contains also 3 premolars. And then let's see about the molars. The upper half of the jaw contains 3 molars and the lower half of the jaw also contains 3 molars. And then let's see the total number of teeth in an ox. We can obtain the total number of teeth by multiplying 2 in the upper half of the jaw and similarly by multiplying 2 in the lower half of the jaw and adding their result. to get the total number of teeth. Hence, total number of teeth present in the ox is 32. And then let's study about the horse. About the dental formula of the horse. First, deciduous. Deciduous incisors. The upper half of the jaw contains 3 deciduous incisors and the lower half of the jaw also contains 3 deciduous incisors. Then the deciduous canine. The upper half of the jaw and the lower half of the jaw contains 0 deciduous canine. And then lastly the deciduous premolar. The upper half of the jaw and the lower half of the jaw contain 3 deciduous premolar. And then the permanent teeth. Incisor. The upper half of the jaw and the lower half of the jaw contain 3 incisors. And then canine. The upper half of the jaw and the lower half of the jaw contain 1 canine. And then premolars. The upper half of the jaw and the lower half of the jaw, they both contain 3 premolars. And then molars. The upper half of the jaw and the lower half of the jaw contain 3 molars. The canine tooth is absent or vestigial in the mare. And remember that in some species of the horse, the age is determined from their dentition. This skill requires lot of practice to be accurate. And then dog. First, eruption of teeth in dogs. First, incisor. The deciduous incisor erupts at 4 to 6 weeks and the permanent incisor erupts at the age of 12 to 16 weeks. And then the canines. The deciduous canines erupts at the age of 3 to 6 weeks and the permanent canine erupts at the age of 12 to 17 weeks. And then the premolars. The deciduous premolar erupts at the age of 5 to 6 weeks and the permanent premolar erupts at the age of 16 to 20 weeks. And then the molars. As we know that the deciduous teeth does not contain molars, hence the permanent molars erupt at the age of 16 to 25 weeks. And then let's study about the dental formula of the dog. First, deciduous teeth. There are 3 deciduous incisors on the upper half of the jaw and 3 deciduous incisors on the lower half of the jaw. Then deciduous canine. The dog contains 1 deciduous canine on both lower half of the jaw and upper half of the jaw. Then deciduous premolar. There is 3 deciduous premolar on both lower half of the jaw and upper half of the jaw. Then permanent teeth. Incisor. There are 3 incisors on both upper and lower half of the jaw. Then canine. The upper half of the jaw and the lower half of the jaw both contain 1 canine. Then premolar. The upper half of the jaw and the lower half of the jaw both contain 4 premolars. And then molar. The upper half of the jaw contains 2 molars and the lower half of the jaw contains 3 molars. Remember that the canine are the longest teeth of the dog and having largest root that are longer than the crown, as we can see in the figure. Then the canine tooth is also called as fang tooth. And remember that the upper 4th premolar tooth is the largest tooth of the mouth and also called as carnassial tooth. Then let's study about the dental formula of the pig. First, deciduous teeth. The upper half of the jaw and the lower half of the jaw both contain 3 deciduous incisors. Then deciduous canine. The upper half of the jaw and the lower half of the jaw both contain 1 deciduous canine. Then deciduous premolar. The upper half of the jaw and the lower half of the jaw both contain 3 deciduous premolar. Then permanent teeth. Incisor. The upper half of the jaw and the lower half of the jaw both contain 3 incisors. Then canine. The upper half of the jaw and the lower half of the jaw contain 1 canine. Then premolar. The upper half of the jaw and the lower half of the jaw both contain 4 premolar. Then molar. The pig contain 3 molars on both upper half of the jaw and the lower half of the jaw. And remember that in the male pig, the canine teeth are well developed. The canine tooth of the upper jaw is curved laterally and dorsally, and the tooth in the lower jaw is more large and is curved laterally and caudally. Remember that many farmers cut off the deciduous incisor and canine shortly after the birth, which often result in medical problems. Then let's study about the salivary glands. The salivary gland are the paired organ that secrete saliva via their duct into the oral cavity. Saliva keeps the mucus of the mouth moist and it is mixed with the food bolus during swallowing. And it also initiates chemical digestion of the food. It also has antibacterial action. There are three main salivary glands, or we can say three major salivary glands, that is parotid, mandibular and sublingual gland, along with multiple smaller minor glands such as zygomatic. Depending upon the glands, the secretion can be serous, that is watery, or mucus, that is viscous, or we can say mixed, that is both serous and mucus type. Here we are going to study about major salivary glands. Let's first study about parotid gland. It is named from its proximity to the ear and its shape is triangular and its color is reddish brown. And it lies on the posterior part of masseter muscle along the caudal border of vertical part of the ramus of mandible. Its average weight is 100 grams. It has two ends and two surfaces. Let's first study about the ends. First is dorsal end. It is broad and placed close to the base of the ear, and second is ventral end. It is narrow and directed in front. Then let's study about surfaces. First is lateral surface. It is covered by zygomatico-auricularis muscle at the base and parotido-auricularis muscle along the ventral length. Then second is medial surface. It is related to parotid lymph glands, stylohyoid bone, masseter occipitohyoideus, digastricus muscle, external carotid artery, external jugular vein, and lastly superficial temporal nerve. The stensins, or we can say the parotid duct, leaves the gland at its medial aspect of the ventral part and goes forward on the medial side of the ventral border of mandible between masseter muscle in front and behind external maxillary vein. Then let's study about the mandibular gland. Its shape is elongated lobulated gland and its color is pale yellow. It is situated along the medial side of the angle of mandible. It is longer than parotid and extends from the level of the wings of atlas to the basihyoid at the intermandibular space. Its weight is about 130 to 150 grams. And then let's first study about the lateral surface. It is related to parotid gland, maxillary and the facial vein, lymph nodes and sternomandibularis muscle. Then let's see about the medial surface. It is related to the lymph node, pharynx, larynx, carotid artery and 10th, 11th and 12th cranial nerves. Then let's see about dorsal end. It is pointed. Then ventral end. It is rounded and placed close to the opposite gland. Dorsal border is concave and the ventral border is convex. The Wattens, or we can say the mandibular ducts, leaves the gland at the middle of dorsal border and runs between the mylohyoideus and hyoglossal muscle and then along the deep face of genioglossus. It passes through the sublingual glands and goes further forward along the floor of the mouth and open at the caruncula sublingualis. Then let's study about the sublingual gland. It has two parts. First is superior and second is inferior. Let's first study about the superior, or we can say polystomatic gland. It is lobulated and its color is pale yellow and is situated under the mucous membrane of the floor of the mouth, and it extends from the mandibular symphysis to the palatoglossal arch. Its numerous ducts open at the base of the papillae situated in a line on either side of the frenum linguae at the floor of the mouth. And then let's study about the inferior, or we can say monostomatic. Its color is pink and its gland extends from the mandibular symphysis to the level of last premolar tooth. It is thicker and shorter than the superior gland and it is situated below it. There is only one duct in this gland which either joins the mandibular duct or opens separately at the base of the caruncula sublingualis, close to the opening of the mandibular duct. Then let's study about the comparative of salivary glands of different animals. First, about horse. The parotid gland is the largest of all the salivary gland in case of horse. There is additional guttural pouch in the medial surface. Then the parotid duct opens opposite to the last upper premolar tooth. The carunculus sublingualis is situated opposite to canine tooth and the sublingual gland is single. Then in case of dog, the parotid ducts open opposite to the upper third premolar tooth. The mandibular gland is larger than the parotid and there is extra gland found in this animal, that is zygomatic salivary gland. It is situated at the interior part of the pterygopalatine fossa. Its duct open into the mouth opposite to the last upper molar tooth. And then let's study in the case of pig. The parotid duct open opposite to 4th and 5th upper cheek tooth. Sometimes small accessory parotid duct is found and the mandibular gland is small. Then let's study in the case of fowl. There are number of salivary glands in fowl. The ducts of some salivary glands such as maxillary, palatine, cranial lingual, submandibular and the angular opens into the mouth. And the other salivary glands such as spinothyroid, caudal lingual, caudal submandibular and the laryngeal open into the cavity of pharynx. The maxillary and the angular glands are monostomatic and other are polystomatic. And lastly, I will give you a bonus information about dental star of the horse. The dental star is present in the incisors. As a result of wearing of teeth, the occlusal surface of the incisor changes, in which the cup gets smaller and finally disappear, and the dental star changes from a line to a large round spot, as you can see in the figure. Stay safe and let's meet in the next video.